If you're having trouble finding a doctor, there is a good reason. The Association of American Medical Colleges says there's a shortage of approximately 91,000 doctors in the U.S., and that number is expected to increase by 2025. New York City, Los Angeles, and San Antonio are the three cities with the least doctors per resident, while Greenville, Atlanta, and Boston are the three cities with the most doctors per resident, according to BetterDoctor.com. Here to talk about this is Dan Kogan. He is chief data scientist and a blogger for BetterDoctor.com, a website which helps consumers find the top healthcare providers in their city. Welcome to Rise Exchange. First, how did you figure out what doctors, the per capita rating of the doctors?
So the numbers represent the averages of residents divided by the active primary care physicians.
You looked at primary care physicians.
Primary care physicians and the pediatricians.
Okay. So what, is driving down, do you think, these cities where the doctors are, there's not that many doctors? I mean, is the population simply growing in New York City?
The New York City is an outlier, obviously, for many reasons. High density, high population, and the very high cost of living. At $100 per visit, PCP cannot afford to have a practice. And we have neighborhood cities where the primary care can be delivered for the fraction of cost.
So are these cities doing anything about the shortages? Are you learning of any programs to sort of encourage doctors? I think of that show Northern Exposure. Do you remember where the guy was sent to Alaska because that's how he got his education?
Well, there are a lot of conversations about how to increase the rate of students going into the primary care specialty. Unfortunately, we're not privy to the information what CMS is doing, but what we know that entrepreneurs in every city trying to bring technology in 21st century, telemedicine, nurse practitioners.
It used to be so many people wanted to be doctors. Are fewer people going to medical school, or are fewer people going to these cities?
Fewer people becoming primary care physicians.
Why?
Most of them go into the specialties because specialists charge 2-3 times more per visit than the primary care physicians.
And they get more from insurance companies.
Correct.
Any data that suggests that the Affordable Care Act is scaring away potential physicians or current primary care physicians?
There is absolutely no incentives by the government for the primary care physicians to exist. The nurse practitioners do deliver the services, and the primary care physicians get much less than specialists.
And but that's a flip side of that question too, because there's an argument in other countries where the nurse practitioners do more. They prescribe drugs, they can make referrals. We don't do that here. Maybe part of the solution is to change the rules.
Absolutely. In 17 states, in fact, nurse practitioners do deliver the primary care. And in 3 to 5 years, we believe that in all states, nurse practitioners and physician assistants will deliver primary care.
So why did you go ahead and do this study? What is the benefits for the readers?
The Association of American Medical Colleges posts the numbers that by the year 2025, the shortage will be about 130,000 physicians, and we, as a data company that cleanse and validate the data, see that.
Okay, we talked about primary care physicians, but is there certain specialties where there are shortages as well?
In every state, the shortage of primary care versus all other specialties is about 50-50. So 130,000 physician shortage will be distributed between 65 to 65,000, all specialties versus primary care. All specialties have the same issue.
All specialties have the same issue, which is
shortage.
A shortage throughout all specialties.
Yeah.
And how much of that, from what you hear from doctors, let's say, are insurance rates and malpractice? I mean, the Doctors Association will say that it's malpractice insurance.
It's hard to say. It's many reasons. Insurances and malpractices is one of them, especially in the gynecology and obstetrics. But in general, it's the fee-for-service structure that basically prevents people from going into the primary care. That's where the biggest shortage is.
Talk a little bit about what your site does. Obviously, people shop now for healthcare the way we shop on Amazon.
Right, and it's true that people do go online more and more, but it's not as easy yet as shopping for the car. Our goal is to make it as easy. Looking for doctors sometimes can be as stressful as getting married. we heard, or looking for the apartment. We combine the multiple sources, we cleanse and validate the data, we present the information in such a way to make this experience
And what are the metrics
easier.
that you have? We have about 20 seconds left. What are some of the metrics? I mean, what makes for a good doctor?
Education, credentials, referring physicians network, feedback from the consumers, ratings.
Okay. Dan Kogan from BetterDoctor.com. Thank you so much.
Thank you.
Terrific.